Hello everyone, welcome back to the channel. In the previous video, I explained the iliacus muscle in detail. Today we are going to learn about the psoas major muscle. As you all know, the iliacus and psoas major muscles join together to form the iliopsoas muscle, which is the strongest flexors of the hip. So both of these muscles are located in the anterior compartment of the hip. So now let's start with the origin of the psoas major muscle. It can originate from the three parts. Okay, vertebral bodies, transverse process, and intervertebral disc. So first is it originates from the bodies of the T12 to L5 vertebra, that is T12, L1, L2, L3, L4 and L5 vertebra. So next one is originate from the transverse process of the all the lumbar vertebra, that is L1 to L5. The finally it also originates from the intervertebral disc between the T12 and L5. So these are all the three origin points of the psoas major muscle. So insertion point it joins with the iliacus muscle and together they inserts into the lesser trochanter of the femur. So that's why we call them as iliopsoas muscles. So just like the iliacus muscle, so origin I said, insertion is also lesser trochanter of the femur. So nerve supply by the anterior rami of the L1, L2 and L3 of the spinal nerve. You can also remember a femoral nerve for easy way to remember. And action, it flexes the hip and helps in external rotation of the hip, bends the trunk forward when the legs are fixed, and helps to maintain posture and stabilizes the lumbar spine. So action is same as the iliacus muscle. So everyday activities is also same: walking, running, climbing stair, sitting up from lying down, or kicking a ball. These are all the daily activities. So the psoas major muscles action and iliacus muscle action is both are same. Okay. Next one is applied aspect. In this applied anatomy, first one is tight psoas major muscle. So in a tight psoas major, it may cause you the low back pain, anterior pelvic tilt, or the reduces hip extension. When you straighten your leg, you can feel the pain over your hip. And second one is weak psoas major. It's very difficult to lift the thigh, and there is weak hip flexion and difficulty to climbing the stairs. Okay, so next one is psoas strain. So this can be seen commonly in runners, football players, or dancers, or any athletes. So psoas strain can occur due to overuse or sudden movements for poor conditioning. So it may limit the performances. So these are all the some applied anatomy of the psoas major muscle. So next part is special test. So first one is Thomas test. Its purpose to check the tightness of the psoas major and iliopsoas, that is iliacus muscle. So if the test is positive, the opposite thigh lifts off the table. It indicates the tightness of the hip flexor. If the test is negative, opposite thigh remains on the table itself. So I already said the procedures in the iliacus muscle, because this Thomas test is also done for iliacus muscle. So go through that, I'll not explain again. So second one is manual muscle testing. This purpose to test hip flexion strength. So if the grade 5, there is a full range of motion against the resistance. Procedure: patient should lie in supine. So test leg which is there, it should be in straight and opposite leg is flexed. Okay, to stabilize the pelvis, and ask the patient to lift the straight leg up and as high as possible. So apply maximum resistance just above the ankle in a downward direction. Okay, so patient holds the leg without any giving way. So this is grade 5, normal strength, a full range of motion against the maximum resistance. Next one is mnemonic. Everything is done: origin, insertion, special test, applied anatomy, nerve supply action, daily activities. Everything is done. Now how to remember them in? So I got one mnemonic called P lift. Okay, P stands for psoas major, which is the, I already said, powerful hip flexor muscle, and L stand for the lumbar vertebra virgin, that is, I said, no, transverse process and intervertebral disc, everything comes under this L. And I, that is inserts into the lesser trochanter, that is joins the iliacus tendon and inserts into lesser trochanter of the femur and forms iliopsoas muscle. So F stands for flexes the hip. So primary option is flexion, right? T stands for Thomas test, which checks for the tightness. I already said. So this is the so so this is the mnemonic for this muscle. Iliacus muscle. What's the mnemonic? You guys know that is I flip. Okay. So this is P lift. So this is the end of today's video. Thank you for watching till this. uh, so if you guys found it helpful, please give one like and subscribe. And if you guys have any doubt, please ask in the comment section. So in the next video I'll come with another muscle. So thank you for watching. See you in the next video.